Blessings and love, peace and wellness. I hope this finds you well. Today I have my beautiful sister, friend, Dr. Carmen Jones. She is here to let all the other folks out there know how she uses her practice as an absolute must have a beautiful bedside manner, I guess we can call it that. We want to make sure that we give everybody the opportunity to know different tools, different things that can aid each of us as the patient, as the doctor, when going in and dealing with post-traumatic stress disorder. I've had a few different interactions of my own that was traumatizing to the point where I ran out crying. I was forced to tell what happened. It was a really traumatic time for me. It was difficult to tell them that I had issues. On top of that, I had to tell them that, hey, be gentle and don't go too far. And you don't always have those words because you're already on 11 by the time you get to the doctor. Your blood pressure is already off the charts, and you're trying to explain that you're okay while not being okay. So I had the pleasure of having one of the best. I mean, going through the VA is one thing, but having an outside service is quite another. But to go to a civilian doctor and say, hey, I have PTSD, or to say I have a mental condition, or any of those things that may be outside of the realm of that doctor, but you know it's important. So I found myself sitting in front of her, wondering, okay, how do we, talk about this while not digging? But then it was something beautiful happened. And she simply said, you don't have to go into it. I just needed to see the diagnosis to know what to do. And you don't have to worry about anything. This is a safe space. I immediately let my guard down. I knew that I was going to be okay. Anxiety went, whew, okay, all right, it's cool. Now we can really talk about what's really going on with me and why I'm here. And I had a full appointment because I wasn't full of anxiety and panic and, oh, wait, I don't want to think about that. And then you're stuck. I didn't even have to go there because her heart knew I need to be sensitive. So I want to just give this opportunity to her to explain how, why, um, how you learn to get to that place, how many patients it took, or whatever that looks like for you. I just want you to flow and express to those practitioners, clinicians, and patients the dues that are needed when you have such a delicate situation.
All right. Well, first of all, Ms. Christina, thank you so much for having me. I really love and respect what you do in this area. And I think that you're a godsend to a lot of people that you're helping. Um,
Thank you.
how to get to that point of being a good doctor with good bedside manner is not so automatic. We all have encountered physicians with different dispositions. Um, obviously that's what gives us choice. You like one, you don't like one, you choose to go to that one, you don't. One of the things that I like to stress is that as a patient, you have a choice. I mean, you don't have to stay in a room with someone who's not respecting you, your time, your condition, and certainly not if they're not listening to you. But unfortunately, the way the medical system is set up today, it's very difficult. I really acknowledge the stress that my colleagues are under, working like almost factory workers, having to push patients through just simply to get the numbers so that bills can be paid. Healthcare is out of control. With that being said, it doesn't mean that you can't continue to improve your skills in how you communicate with the patient, even if it's a short amount of time. All of us as humans want to be heard. I didn't make that up. I think Oprah is probably the one who reminded us that all of us just want to be heard. With that being said, my background is actually in pediatrics. And I think that that helps quite a bit when trying to talk to someone who can't necessarily talk back to you. So I was trained in pediatrics. I feel like I did very good work in that area. Um, I learned how to get a child to be calm, um, so that I could examine them and diagnose them. It's not so easy, and not all doctors are able to do that. Of course, those of us that are in the field, we improve our skills every patient. We learn how to deal with difficult situations all the time. But I believe that that training and that experience over, greater than 25 years helped me as I transitioned to seeing adults for more natural healing. I believe, if I'm not mistaken, you and I met under the circumstances of seeing a functional medicine doctor, and I was acting as her medical director, I think at the time, but managed to talk to you, get to know you, and then we have worked on several other things since that time. But I think it also comes from who you are as a person. I have other friends that are disabled vets, personal friends with similar stories to yours, and I can't believe I'm saying that because that in itself is horrifying. But having those personal relationships, having compassion for that person, having compassion for any person as a human being and what they've been through, what they know, what they don't know, certainly compared to you as a healer, as a physician, as a person in a seat of authority, if you will. um, I learned how to help patients empower themselves. So when I'm talking to a patient um, that may have some mental health condition, whether it be something, I don't even mean to downplay this, but something as simple, if I can use that phrase loosely, as anxiety or depression, to something as complicated as PTSD, or even with schizophrenic type uh, disorder, a schizoaffective type disorder, it's all the same. One thing I have to do is meet that person where they are. Allow them first to know this, you have come to see me. I need to hear what you need to say. And it is my job to get that information from you. I remember one time in training, they talked about it's your job to get the history and then do the physical. That you can't do, you can't diagnose anyone until you get the history and the physical. There was a phrase that used to go around, and they used to say, the patient is a bad historian. They don't know any answers. They just can't tell it. I can't diagnose them because they didn't even tell me that part about their history. They forgot to tell about the surgery. They didn't even mention that they had back pain. So there would be all that sort of complaining. And at the same time, a wiser senior physician said, the historian records the history. It doesn't just show up on your front doorstep. You have to go get it. So I never forgot that lesson because it was very applicable to me when I'm trying to talk to children who can't tell you what's wrong, don't necessarily know how to describe where it hurts. They may can point to it, but they don't know where it hurts. I don't see adults as any different. And in that way, I think that that created a different sort of environment for patients talking to me. So as I started seeing other types of patients in this, I call it part two of my career, I started to learn that all people want is someone to listen to them. So I typically will empower the patient, remind them that they're in control. I have a job to do, yes. My job is to get that history of your condition, of your illness, of your disease, write it down, make sure I've got everything. But I like to empower the patient to say, it's your body. It's your condition, it's your situation. If a doctor is not listening to you, or if a doctor's not treating you well, you have a right to change. You can change doctors. You don't have to do this today. There are consequences with that. You may not get the thing you need. And that's where I think a lot of patients find themselves. They may need their pain medicine, they may need their blood pressure medicine, but I still believe the same thing. So, very often when it comes to PTSD, my sensitivities are really high only because I don't know what that means. That can mean anything from childhood sexual abuse to I stepped on a IED in Iraq. Either way, they were traumatized. More often, I'm seeing young men who are released from prison who never saw a smartphone. They have PTSD. They're afraid to leave the house. They don't know what the world is like. It's a very difficult place. It's very difficult to have compassion for someone you learn has maybe committed a crime against society, but that's not why I'm there. So my role is simply to listen to them, be respectful of their place and space on this earth, and record the history. So that is what I do, and that is probably what you're alluding to when you say you felt comfortable, because I came to you in a place of understanding that I don't know your life, I don't know what you've been through. So I usually start by, hello, Christina, I'm Dr. Jones. Please tell me what you want me to know about you. And by doing that, I found that it immediately sets people at ease because a lot of times, like you said, their trauma is so great that they have told that story to this referral, that specialist, that primary care doctor, and they just don't want to tell it to one other person. So I start by saying, tell me what you want me to know. How can I help you today? What brings you in? And sometimes they'll say thank you and tell me everything. Most of the time, I don't want to know everything. And that is because I have to protect myself as well. And sometimes it's not necessary to know everything. I sometimes wonder if my colleagues are a bit nosy because if you're there because you have pain in your big toe, I don't necessarily need to know everything that may have traumatized you as a child. So there's also an element of um, being discerning, an element of knowing what you need to know to get your job done. And if I feel confident that I've done that, there's really no need sometimes to make people rehash the most painful and difficult parts of their lives. If I can diagnose you with, a broken pinky, well then I don't really need to know all those other things just because it's a diagnosis written down in your history. Now, if you are there because you want to discuss that, of course I can, but I always make sure to stay within, my limitations. I am not a psychiatrist. I am not a therapist, as it were. So that's not why I'm there. But if I'm there acting as a physician that is going to help you towards healing in a more natural way, then that's exactly, what I will try to do. And I hope that, I don't know exactly who's going to see this. I am not speaking for all physicians. I'm speaking strictly for myself. This is how I approach another patient. And it's actually how I approach all of them, PTSD or not, because everyone has a story. And I actually like people and I respect them and I want them to like and respect me. It makes both of us able to do our jobs better. I have gone on and on, haven't I?
I actually think you flowed perfectly as a doctor, how to advocate for yourself, how to advocate for your patients, and how to protect yourself too. I don't think a lot of people understand. Me being an advocate for veterans, I hear a lot of traumatic things all the time, and it's normal in the veteran community when you're young and you're in the VA and you can hear anything, in the regular waiting room. So for someone that's a physician that's seeing constant, events of someone's life, I have to always be sensitive to, like, oh my gosh, I'm going to tell this woman, I might ruin this woman's life today. And as a patient, you have to be sensitive as well and recognize that that's not just going to affect you. It takes something in you to have to regurgitate that pain. A lot of people ask me, like, how can you just talk about it? I've been a sick woman for a long time with a lot of physicians that asked a lot of questions that I didn't want to answer. And I had to find a way to talk through it. And it was difficult and it took years. But there were some times where I would just write, my medication list was this long. I would also have a list here that said in my psych history, really quick, what not to ask. It was too sensitive for me during those times. And I was switching doctors or PCSing and going from state to state or doctor or hospital, and each one has to review that historical data. And wow, you're super young. What happened to you? I found a way. I wrote short letters. Hey, please don't ask me about this. It's pretty traumatic. I don't want to traumatize you any more than I want to go back through it myself. So just know, it was sometimes just something that simple to go with my medication list. One time I remember I had my doctor, I had to switch at the VA and they would have it in the notes, not to do it. I was very specific. I do not need to continuously do this with a new person. And I found, there's different aspects that everybody has to learn for themselves. But it's about knowing that you need to have a piece of you. You don't have to surrender yourself to the white coat. You don't have to surrender your health away. They're there to help and aid. It's up to you as the patient to get the rest of it down. You can't expect them to be the savior. They're there as, a channel for you. And you have to respect that channel, as precious as it is. You didn't have the answers, obviously, so you went to that person. So I know what it's like to have that anxiety and it to come off wrong. And I've actually had to go back after I've had a moment and someone pushed me into it, and then I'll be like, I'm so sorry, I'm sure that traumatized you, please forgive me, I want your expertise, just realize where I'm coming from, I'm so sorry I snapped. And as a human being, you should go back and do that if you have the mindset to clearly ground yourself and go back, respect that place as that doctor should respect your place. But at the same time, realize it's a team effort. And yes, to those doctors that got to get me out in 7 minutes because they're an hour behind and they already didn't eat lunch and it's 2:30. Um, I respect them. And yet I waited for that appointment for 40 days too.
Yeah.
But it's that hard part where you have to say, okay, when you're in that waiting room and it's been over 30 minutes, I start writing. If I already don't have my agenda, I start writing. Here you go. Here's the rest of my questions. Have your PA call me.
That's actually excellent. I have always done better when patients come in participating in the process. It's also helpful for them too because it helps them focus. A lot
Yes.
of times patients have a lot to say, or they start talking and they're really good at talking. So they continue to do it, not realizing that, there's a line of people behind you. Not to say that they don't deserve, that
Right.
time, but it's also one thing to be efficient. So advocating for yourself, that is exactly what I mean. That's another way of doing that. Having your problems already written down, the medications that you're already on. That's very helpful. What you said though about discussing or not discussing certain aspects of your PTSD, that too is very helpful. Because now the doctor knows, please don't do this. Don't do this. And again, as you were talking, it brought me back to a very close friend of mine who has PTSD from military sexual trauma. And every single Tuesday, I would get a call at 2 o'clock just traumatized, friend, not as a doctor, a friend, just traumatized because she had to tell the story again. And the painful anxiety that led up to her even having to go to the visit. And I was just heartbroken for her and did not know how to help her as a friend, let alone as a physician. And I wanted to call over there and say, hey, you guys, why are you doing this? Is it necessary? It's not her fault that the clinic she's going to requires that a different doctor is there. How does that solve anything when you can't even get continuity of care? You can't establish a relationship because of whatever your insurance is or whatever type of clinic it is you have to go to. So again, I'm back to patients need to advocate for themselves. And you, with the way you do that is you come prepared, like we just talked about, and you know your limitations and you make them known.
Yep.
And you do not allow yourself to be traumatized again and again by people who are on a clock. And the final thing, or not final, but the other thing that I will say again is remember, as humans, we physicians take this home too. There's no escaping that we have to take in that energy that you all bring us when you are sick and or hurt, whether it be physically or mentally. I have
Yes.
seen some things. We all have. Horrible things sometimes. Very happy things sometimes. It's always good when people do better. But sometimes the days are really, really long and bad. And it's interesting because mental exhaustion is sometimes worse than physical exhaustion.
Oh, yes.
And so I remember coming home going, I didn't do anything but talk all day and I'm exhausted. But I realized I got it all, my brain was busy
All
working.
day, all day, and then processing when you get home. And that's what I try to explain to people. Even watching when I went through a therapy called Overexposure. So that's where I had to listen to my traumas every day, about 10 times a day, the story. It's an overexposure technique to desensitize you. And I went through that program, and it was very hard, but I figure, hey, if I got to tell one more story, you know what? Let me just go ahead and tell that story, and I'm going to go ahead and do this therapy. And it was hard. It was real hard. But through that process, that's where I learned my problems. I would have anxiety a week after I made the appointment, 2 weeks before the appointment. I'd even think about how ways to cancel the appointment the week prior. And
Mm-hmm.
then I even did sometimes then call back and then try to hurry up and get it right back. It was so bad. So, I mean, it was one step at a time for me, but I didn't know what to do during those times. And I realized I couldn't communicate. It was exactly what you were saying. What I was saying wasn't what I needed to say.
Mm-hmm.
It was literally derailing the whole conversation of my medical appointment
Mm-hmm.
because it was in a complete emotion mind rather than my logic that I knew I would fail. So at least I'd have some logical paperwork and some emotional words. So maybe they can put it together and make a rational sentence of what I needed. But even now, like when I'm working with veterans and I'm advocating, that's one of the main things I say. Okay, where's your list? Do you know about your disease? Do you know anybody else with your disease? Do you know the foundations and nonprofits of your disease? Have you went on Facebook to find the community? A lot of my answers as a patient could be found there, not with you, because it's the experience of it. Hey, I was taking that methotrexate and I all of a sudden started getting boils. Does anybody else get boils? Me too, and all these things come flying up. Meanwhile, Google's a going, and then we show up with this, look what I have, it's a new disease.
Mm-hmm.
I Googled it.
Mm-hmm.
So, and then of course you're
We
already
love that.
it's like, no, 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 no. So I really felt like those supports and advocate groups gave me a lot of the peace I needed that a lot of us search in that short time frame in that little tiny white box of a room that we have to sit in and wait impatiently. I feel the warmth of every physician that comes in, I feel that they had a bad patient. And sometimes we can hear it. We can actually hear the patient next door like, dude, I mean, my stuff was bad, but we're experiencing it if we're not, already like in our phone trying to escape and avoid. But I wanted us to advocate as a whole. How can we make this better? We can't help our healthcare system right now other than do the right thing and vote and make sure that we express our concerns to our doctors, physicians, hospitals. We have to talk. We have to use our voice. We have to say, this doesn't feel good. I don't like this. They don't know. I mean, it's almost like I sitting in the hospital. It's almost like this. Sometimes you just see just a whole loop. If you pay attention to the white coat, you'll see this.
Mm-hmm. Yeah. Mm-hmm.
And it's like, wait, no. And it's so fast. And if we can just step back and just not stand in each other's shoes, but appreciate each other's shoes.
Yeah. Basic respect for another human being.
Yes.
I mean, actually, I mean, with the climate in our country right now, I've been saying this for the last, couple of weeks. It's just basic respect. I don't know your experience. I haven't lived in your life. I haven't walked in your shoes, but I'm really interested in it.
That's right.
So tell me what you want me to know.
Open mind.
Mm-hmm.
Open mind.
Yeah.
I am so thankful for you. Is there any last positive words out there for patients, doctors, families? I mean, we didn't touch on that. I'm sure we can do another video for families that, can help support those that can't communicate. Some of the things that we both talked about, you can use and do the same thing. Write down your moms, your dads, your grandmas, your babies, journal. We'll tell you all the time, if you aren't able to remember things, you need to write them down. You need to journal them because you're not going to remember if you're in pain. Your receptors are going all over the place. You just can't remember when you're in pain. You have to write things down. You have to make sure you're paying attention to what you're doing, to yourself and for yourself. So I say that for families, if their caretakers are out there and listening to this.
I will reiterate the same thing, and that is, everyone essentially is in charge of themselves. When it's all said and done, you are your best friend, you are your best advocate, and you are the one who knows most about you. If you do not know those things about yourself, you cannot be angry if someone else doesn't know it.
Mm.
So people can't read your mind. Even if they can, it's not their responsibility. You have to be the best advocate for yourself that you can be. This may be foreign to some people because they're givers, they're nurturers. They don't put themselves first. But when it comes to your health, physical or mental, you must be your own advocate. And it's immensely important. It's a very mature thing to do. You have to think about that. When you're a child, you look for your parents to feed you, clothe you, bathe you, etc. When you become a grown up, whatever you think that may be, age you think that may be, you have to take those responsibilities for yourself. It is not someone else's fault
Mm.
that you either don't know yourself or can't explain yourself. And you have to do it in the best way you can, with the tools that you have. But hopefully, conversations like this, advocates that are in support of you, um, can help you to get to that point. So
Absolutely.
you advocate for yourself, fight for yourself, stand up for yourself, all respectful. And if you're not getting that respect back that you give, then you have the right to make a new decision, go a new direction. But always do it with kindness and love to yourself. But just remember, people can't read your minds, so you have to learn how to communicate your needs.
That's right. I am so thankful for you. I cannot tell you how much this is going to change people's lives. It seems simple for you and I. You know, we do this regularly, but it's every day I hear I see a light bulb, aha. You know, it's just those little nuggets that are perfect. So I know this is going to bless a lot of people. And I thank you so much for everything. We're going to say good night. We've had long, long days. So blessings and love to everyone. This is Dr. Carmen Jones and Miss Christina Thomas.
Thank you again.
All right, bye-bye.